Hello, I hope you all had a fantastic Thanksgiving break and that you all got some rest and relaxation in as we wind down the rest of the semester. We do have a number of things to get completed in this class still, but I am confident you are all reaching the finish line, and I'm sure everybody is ready to reach that finish line as well. I can tell it in your writing. So I sent out an invitation before break about the final exam review meeting that I have, similar to what I've done in my research class. For those of you that are in that course as well, which maybe everybody, I'm going to hold just kind of a review session, a question and answer meeting for everybody. I'll record it on Zoom, so if you're not able to make it, I'll post it in the course shortly after the meeting, and that way you can have it to review, and that way you're not missing anything for the final. The final is 20 points, multiple choice questions, short answer type stuff, and you've got like an hour and a half to take it, I think is what I set it for. So it's not, like I said before, it's not tricking you or anything like that. We also have, so this week you've got your final, like, really graded discussion. The discussion for the next module or final module will be bonus points. So and then you also have your fourth reflective paper. I really enjoyed reading the third reflective papers. I think I should have made a note to myself to have that third paper due a little bit closer to immersion week. I wanted you to have some time to reflect on immersion week, but maybe that was a little bit too much time to reflect. But I can tell that I get this feeling, if that's a thing that you can get from reading students' papers, but I get a feeling that you all are eager to get into the theories aspect of the program and really start fine-tuning the skills that you're going to be using in the 606 class. So I'm very excited for that, and I'm excited to see what 606 will bring for all of you. Oftentimes students will come into the 606 class thinking their theoretical orientation will be one thing, and then they get through it and they realize it's something completely different that's speaking to them. So again, so we have one more reflection paper. Hopefully that's not too taxing for you all this week. And then hopefully you all are getting your baseline videos set up. I encourage you to do those sooner than later because things happen, with people getting sick and COVID exposures and all of that stuff. And so, please do not wait till the last minute for that baseline video. Having it due on the 9th, there's a certain point where I cannot accept late work anymore because I have to get grades in. So if something comes up with those, please do let me know sooner than later, and we'll try to get everything set up and settled for you all. So hopefully you all can join me for the little final review. It won't take too much of your time. And as that way we can wrap up this semester. Excuse me, I'm getting over something myself and my voice is just in and out. So it is what it is this fall season. So this week we're going to be talking about counseling individuals with substance use disorders. I'm going to acknowledge right now that this is a very, very minuscule amount of information on providing counseling to individuals with substance use disorders in the grand scheme of things. We're going to be talking about this a lot more in depth than 606. You have an entire class about it. And so I'm just providing an overview, and I also just want to kind of highlight some things as you move forward in this program. So I understand completely that you will read and find things where substance use disorder is not the terminology. Maybe it's something older. Substance abuse is being used. Individuals that are in recovery or that are going through recovery may use different terminology themselves. But for the purposes of me and my classes and this program, I just do encourage you to use substance use disorder when you're referring to this classification of individuals. So addiction in and of itself, the disease process, there are different ways that we might define addiction. The APA, the American Psychological Association, says that addiction, is a chronic disorder with, and this is the part that I like the most about the APA's definition, with biological, psychological, social, and environmental factors influencing its development and maintenance. And I think, it really maybe is, I say more recent a lot when I'm talking about the longevity of our counseling profession, because, things have changed in the quote unquote more recent times, but that's probably really like a 25, 30-year span at this point. But I think we are now at the point, and there's been a shift in society's understanding of addiction, addiction as a disease process, and the influences, the factors that influence addiction in individuals, and the larger role that genetics plays in that process as well. So I really like that we're not just talking about social and environmental aspects to addiction within that APA definition, because it certainly is not that. So when we say substances, what is meant by that? I mean, this is a really limited list. Let's be honest here. I put marijuana on there because it's still not federally legal, so it is a substance that is not able to be used widely by everybody in America. So that's my tiny little soapbox on that one. But of course, opioid painkillers, sedatives, stimulants, tobacco, sugar should be on here, in my opinion, if we're talking about addiction, but not technically substance use disorders. But they're all different types of substances, and we in Appalachia and West Virginia are, probably more aware right now of the effects of substance use disorder on populations and generations, truly, and communities, and the economies of an entire portion of the country at this stage. It's important to mention that in terms of the historical use of substances, they've been around since ancient times. You can find references to different hallucinogenic substances, far, far back in the history of humanity. Different cultures have and still do use substances in rituals and ceremonies and as part of celebratory events and gatherings. Negative consequences tend to happen whenever one culture introduces a new substance to another culture. And a good example of that is rates of alcoholism within indigenous people in this country. There are some theories or theoretical orientations that are more commonly utilized in recovery-oriented organizations or treatment facilities. Solution-focused brief therapy, motivational interviewing is probably top of all of them, and narrative therapy is a big one as well. And I think the underlying theme with all of these theoretical orientations is that they're all very strength-based. They are non-judgmental. They highlight change, and they do not look down upon those individuals that end up, using substances again. So I think there are common themes that flow through all of them. I actually put in a couple of in the supplemental reading folder that you'll find with this module, there are a couple of different topics that relate specifically to motivational interviewing. One is a journal article that I think is really useful. The other is just an overview of what motivational interviewing is, or MI as people like to call it. The journal article, I think, I was happy to find it myself, because I talk about motivational interviewing in the 606 class as a theory, but technically it was not, whenever we saw techniques and practices around motivational interviewing being used, it wasn't initially grounded in theory. And, what does that mean? Well, for those evidence-based practitioners and counselors, we like things to be grounded in theory. It's like the chicken and the egg sometimes, especially with motivational interviewing. But the article, I think, provides a nice overview of how you can incorporate different, more maybe traditional or researched theories into different aspects of motivational interviewing, which is all about change and non-confrontational relationships with clients. So that might speak to those of you that really are adverse to confrontation. I think it's really important to examine, and you'll continue to do this especially in later courses, but review your values, your beliefs, and the bias that's inherent in you around substance use and substance misuse and addiction in general. What is your view of substance use? I was thinking about this actually just yesterday. My husband was talking about somebody that lived in a neighborhood close to ours, and he just nonchalantly, quite honestly, just mentioned that this individual had died of an overdose right after they had graduated high school. Or he said he overdosed, and I said, well, did he pass away? And he said yes. And I think here in West Virginia and other parts of Appalachia, the fact that it's become such a commonplace thing, that we see young people in obituaries that have passed away, and it's just kind of an understood thing that that's probably the underlying issue. So I think that and I'm just speaking for myself, just even living here in our communities and our society and seeing the negative effects and the impacts, and knowing people that have had just ongoing issues and lack of support systems, and knowing individuals that have gone through recovery systems and have made it to that, or making it to that other side, and are living valuable and meaningful lives. I think we have to take all of that into consideration as we work in this role as counselors, because every bit of how I think of substance use disorder is shaped by my experiences, along with my education, and along with my continued development of competence around substance use disorders, which is ever changing. So I really think that, again, this is something to keep in the forefront of your minds when you're thinking about substance use disorders. And I often find a lot of students, when we get to the practicum and internship experiences, are hesitant, or just very, grounded in their belief that they absolutely do not want to work with individuals with substance use disorder. And I think that you'll find that there's not really a way necessarily to get away from that, and that the work that is out there and available is meaningful, not only for you as a counselor, but obviously for the clients and their communities and the people that are there to support them. It's much needed in this region and the surrounding regions. There's a great deal of need, and I think there is a respect for the individuals that are working in substance use disorder facilities and treatment facilities right now, because of the overwhelming need for that. And so I always encourage students to just kind of think outside the box. I worked in traditional vocational rehabilitation counseling, and I can't tell you how many individuals, largely men, who came and worked with me that had chronic back pain, or shoulder pain, rotator cuff surgery, whatever it might have been, that also had a substance use disorder. And so regardless of whether or not I thought I was going to be working with individuals with substance use disorder, I still ended up doing it. So you have to address your worldview around substance use disorder. And again, I emphasize that our understanding of SUDs is always changing and being modified, based on understanding of the biological, social, environmental, and all those other factors that come into play when we think about addiction. So we're thinking about actual treatment and counseling of substance use disorder. Treatment is often court ordered. A client might be resistant. It's not always court ordered. Individuals certainly do go and seek treatment independently of the court saying that they have to do it, or independently of them being mandated to do it, or being given essentially an ultimatum. You either do treatment or you go to jail, one or the other, you pick. If you are working in a treatment facility, there are unique challenges that come in with that. Again, I'm doing real broad-based here, but clients that might be resistant because they're not there on their own free will necessarily. You may need to report progress, and so there can be issues, not issues, but certain unique aspects to working in a treatment facility around confidentiality. So sometimes things are not going to be confidential because of the nature of why that client is seeing you. A relapse happens, and that I could not underscore anymore. It's more common for individuals to relapse than to not relapse. So that's always an important consideration. In terms of counseling, if you're thinking about being in a private practice or a more traditional like mental health counseling facility, the client might have volunteered to seek services. They may not. They might have also been provided with an ultimatum, but maybe it is that they don't need to seek actual residential treatment facilities. Maybe they're not at a point where they would need to go through the detox process, or have somebody have medical oversight during those initial weeks of stopping use of whatever the substance is. So taking the position in a counseling relationship of a consultant can benefit a relationship. Being on that level of a consultant is more of an even playing field, rather than coming to a client as more of an authoritarian figure. all-knowing figure as a counselor. So it's important to just consider that. Counseling may involve others close to the client. It may be more around family treatment, couples therapy, one or the other. It's important. I always say things are important. I feel like I should not use that term. Everything's important, my goodness. But there are licensed professional counselors that do provide family counseling and have additional training so that they are providing family counseling in that manner. LMFTs, so individuals that are licensed family counselors, those individuals have a different education and background, and it's a different licensure procedure. So I think there sometimes is a little bit of confusion about that. You can have an LPC, you can provide counseling to families, you want to make sure that you're trained in how to do that, and just taking one couples and family class does not constitute what competence would need to be in order for you to call yourself a family counselor or a couples counselor. So additional training might need to happen. But in terms of substance use disorders, oftentimes it's not just the individual. There's a larger group of individuals that might be participating in some way in the counseling process. And again, in individual counseling, relapse happens. And so if that's part of the bias and values and belief system you have around substance use disorder, that somebody who is in recovery should or will not ever use again, that is something that you would need to evaluate before ever working with an individual with a substance use disorder. So that's tying in some thoughts from the previous PowerPoint. So in terms of accessibility to programs, and accessibility to services, I think there's just a limited amount of services, quality services, and access to service in certain areas, in rural communities, especially in Virginia, Kentucky, West Virginia, and certainly in rural places across the country as well. Eligibility for benefit programs can certainly be impacted. I know of a family that had been trying to receive counseling services but simply could not afford them, even with insurance, because the copays were too great. So it just is something to be considerate of if you're on the other side in the counselor chair, that there may be alternatives for those clients so that you're still able to provide services. Employment concerns for individuals with substance use disorder are ever present, and I think there's been a good shift, and this is really in the more recent past, in the past like 5-10 years, where we see residential treatment facilities, sober living communities really expanding their scope of services to include employment and vocational counseling, because everybody's got to do something to make a living and earn some money, and the psychological benefits of having and holding and maintaining employment and providing back to society, are something that's been studied and researched since the beginning of vocational counseling, quite honestly. But there's certainly problems that can come up for individuals with substance use disorder. Relapse, again, a typical or a normal part of the process overall, but certainly it can be a barrier to employment. Having criminal records, we're seeing a little bit of movement from the criminal justice system on that in specific states, but not as fast as I would like to see it personally. And I think it's important that individuals need to understand their rights under the Americans with Disabilities Act. So there are specific privileges and coverage under the ADA that apply to individuals with substance use disorders. Things can be looked at a little bit differently, but it's important if you're working with a client at any point and they're having difficulty maintaining employment, or if they've been terminated from a job, or if they want to seek treatment but they're worried about taking time off of their job, certainly there might be some coverage for them under the ADA. So that was, again, surface level amount of information about substance use disorders, but I hope you find the information, the supplemental reading beneficial as you go through the rest of this module, and then you're able to reflect on substance use disorders as they are portrayed in media in this week's reflection paper. So with that, I'll leave you all to your work, and I hope you have a fantastic morning, afternoon, evening, middle of the night, whatever it might be, and I will talk to you soon.